Good morning, guys. So hi, how are you? I hope you're all doing well and that you are staying safe and healthy and are happy. So today what we're gonna do is we are going to diagnose another patient. So this will be Miss K. Miss K is our patient today. And so you guys definitely need to watch this video for the whole length of it, so that way you get all of the information you need, so that way you can do the assignment that is in assignments in MS Teams. Okay, so let's go ahead and get started. All right, so here's Miss K. She is our patient. All right, so Miss K has come in today and she is not feeling so great. All right, so let's check out her patient intake form. So Miss K is 57. She did get a flu shot this year. She has not been out of the country in the last 6 months. She tells us that she is not a smoker and that she has not been hospitalized in the last 2 years. Okay, so the reason she's coming in to visit us today is that she's been dropping things a lot lately. Her fingers have been tingling and she feels tired and weak all the time. All right, so we're going to check a couple of things it looks like and look at try and figure out what's going on. All right, so I'll go ahead and open this up in another tab real quick, but we're going to go ahead and go back. So what is Miss K? She's dropping things, her fingers are tingly, she's tired and weak all the time, so we need to help her out. So you feel her fingers and they don't seem to be broken. She doesn't feel like any pain or anything like that. And so in fact, there doesn't seem to be anything wrong with them. So what type of body systems do you think are maybe involved with this? Well, if it's her fingers, right, her bones, maybe, and like it's obviously not her skeletal system because they said, her bones are not broken. But what would maybe cause a tingling sensation? Well, when we think about what causes feeling and what causes you to be able to sense stuff, that would be our nervous system, right? So the nervous system is probably the system we need to look at. All right, so we decided to test Ms. K's nervous system. We're going to record the results of each test on our handout. So for memory, you asked Ms. K to repeat these numbers in order. 5, 8, 3, 7, 2. So she does that. Oh, and she gets it right. So when we look at our tests here for memory, right, she is normal. All right, so let's go to our next test. All right, simple math. For simple math, you ask her to add 1 plus 4. Let's see how she does. 5. Good. So again, simple math is normal. All right, let's try the next thing. For vision, you hold up 2 fingers and ask her to tell you how many she sees. So we're holding up 2 fingers. Oh, well, that's not exactly right. So her vision, on the other hand, seems as if she's having double vision. Okay, well, that's a little concerning. So let's go ahead and check her next step. Okay, for coordination, you ask her to tap her head and touch her nose, but she is not able to do both of those things at the same time. So her coordination, well, she's not very coordinated right now. She can't tap her head, touch her head, and touch her nose, okay? Can't do those things. All right, well, don't want that. All right, so we decided to perform a knee-jerk reaction test like the one shown here. But it tells us, so here's the test, and that's normal. That would be a normal test. But as you can see here, when we test her, hers is very slow, which is not good. So she's like responding very late when we do this to her. So we should probably indicate that. So on the knee-jerk reaction test, it is slow. Okay. So we need to try and figure out what is going on with her. So we consult a medical fact sheet that describes common disorders of the nervous system and their symptoms. You compare the information from Ms. K's intake form and her test results with the description and symptoms for the 3 disorders listed on your handout. It is your job to decide which diagnosis you think best fits the patient. All right. So we'll look at our medical fact sheet. Okay, so some disorders of the nervous system. So first we have Alzheimer's disease. So this disease destroys memory and other important mental functions. It starts with just a few signs, usually in older patients, 60 years of age or more, and progresses to more severe symptoms as the brain cells and brain cell connections deteriorate and eventually die. Symptoms may include memory loss, confusion, inability to do simple math, and getting lost. All right, so that's one. Next is epilepsy. So epilepsy causes sudden attacks called seizures. During seizures, brain cells are abnormally active, which can cause a person to lose consciousness or suddenly shake all over their entire body. The rest of the time, brain cell activity is normal. So symptoms may include fainting, and then muscle spasms and sudden jerky movements. Okay, all right. And then finally we have multiple sclerosis, or MS. This disease occurs when nerve coverings are damaged and the communication between the brain and the body is disrupted. Symptoms may include double vision, weakness, and poor coordination of body movements. Okay, so you need to decide which of those diseases is most likely what Ms. K has. Okay, so you can discuss with your peers if you would like. Okay, so you're going to talk about today which diagnosis you believe is most likely and why. You're going to come to an agreement. You'll pick one. So this is going to be a little bit different than what we do in our notebook, because I'm going to just put the assignment on the TCI or on the MS Teams site. So you should see your assignment in there. Okay, so we are going to tell Ms. K what is probably likely that she has, and we're going to pick out some different evidence. Okay, so we'll pick out different evidence and you'll have to explain why you do that. Okay, so I hope that is helpful. The assignment is in MS Teams, so make sure you do that. And always consult this video to make sure that you are answering the questions correctly. If you have any questions, please let me know, either on Text Remind, on here on MS Teams, or an email. Okay, so MS Teams and a reminder are going to probably be the fastest though. All right, guys. Well, I hope you have a wonderful day. I'll see you and talk to you later. Bye. Bye.